as well as the public side of media, be it television or radio, since 1960. Alrighty, it's 4 p.m. Stay tuned for Take Charge of Your Health coming up here on WBAI, New York. Here we go.
Hi, this is Take Charge Your Health with Corinne Furnari, clinical nutritionist, physician assistant, and Carol Peterson, pharmacist. Listen, learn, and I hope you enjoy the show. Bye.
Welcome back. This is Take Charge of Your Health with Corinne Furnari, clinical nutritionist and physician assistant, and my co-host, Carol Peterson, pharmacist. Every week, we present you with new and creative ways to help you make sense of health information and bring it home to you and your family. With years of clinical experience between us and research into traditional and cutting-edge technologies, we give you practical information to help you take charge of your health.
Okay, Corinne, we can't hear you. So welcome back, everybody. We're going to be talking about osteoporosis today. And we've covered this before, and there's many aspects of osteoporosis. I was thinking about this as a good topic because recently I went to the dentist and I had some x-rays done. I don't like to have it, so it's been a while that I had x-rays done on my teeth. And I came up with some cavities under my bridges. So the bridges are sometimes is a problem with cavities. And so outside of my advice from my dentist to rip out my bridges and then fill the cavities, and then in one case, the cavities near the root. So the dentist says, oh, we'll have to do a root canal, or we'll have to pull it and do an implant. And I'm just horrified. And I know we can repair our body. You give your body the right things, you can restore what's going on in your body. So why not give it a go? So I've decided what I'm going to be doing on this particular issue, the cavities, is to give myself 3 months, and I'm going to optimize as much as I can with everything that is going on with remodeling the enamel in my teeth, and also giving a chance for those cavities to heal. So it's an infection. So you have an infection, and then you have your bone is disintegrating. So it made me very curious. I looked it up and I said, is there a connection with cavities and osteoporosis? And lo and behold, yes.
Yes.
But
yes, welcome to the show.
It's not quite direct
as
it happens, but if you have a tendency to osteoporosis, your risk of cavities increases. So it makes some sense about your body's ability to remodel. Corinne?
So today we decided to talk about osteoporosis, which I said, oh my goodness, that'll be wonderful. That'll be easy. I know it all. Boy, was I in for a big surprise. Not that the information was so new and different, but that the information is now part of the main relationship through the Osteoporosis Association being available to people. to people looking this up. Osteoporosis is a larger problem than we realize. First of all, there's over 26 million people who worldwide who have been diagnosed, but then there's many who have not. And of those people, of the people who have osteoporosis, who get a fracture in their femur, within 6 months they have died. And many of those people, 20% of those, so now we're looking at 20% of the 60% that didn't die, become permanently disabled. So this and osteoporosis is now the number 2 cause of death in women, but it also affects men, but particularly women in the States. So let's go through some of the things. It's interesting because some of the things that were written up are exactly what we were saying 20 years ago. But I was nervous to say it on the radio because I needed more proof. Guess what? The proof has flooded in. We don't want thick, dense bones. We want strong, resilient bones. And that is created through diet and nutrition. And so let's start from the beginning. What's the number 1 protein in our bone? 90%. But guess what? It used to be if you had any type of bone problems, first thing they do is tell you to take more calcium.
Yeah,
But
not going to do it.
but
It's a very
90%.
complex situation.
It's very complex and very interesting and also empowering because it's all up to you. The 90% of the structure of the bone is collagen.
Yep.
It's a collagen protein. And it's very interesting because collagen is strong, but it's movable. So if you jump, your collagen might tighten a little and then go back. If you fall, there could be a slight bend and it moves back. Collagen is strong but movable, and it's what creates the human skeletal system.
I have an example of that. I had my daughter with me, and she was much younger, and we were giving a ride to a massage therapist. He worked for a sports team, actually. And we were talking about this very subject, how your bones are supposed to be flexible, not hard. And so he took my daughter's arm and he bent it. And I go, whoa.
Oh my goodness.
He said, look, that's how your bone is supposed to be. And I really like your picture of being a shock absorber, that if you don't have that flexibility, you're more prone to break things because something's got to give. So that protection of those proteins making up the collagen are really, really important. And we hardly ever talk about this.
And you know what? When I had patients that would come in, I had one lady who was in her mid-60s who had osteoporosis, diagnosed osteoporosis. And they wanted her on a bisphosphonate, which is medicine which acts to reduce the rebuilding or the reduce the breakdown of the bone, and but in that it reduces the buildup of the bone, so the bone stops circulating. It stops being a live tissue and becomes a solid, visually beautiful on X-ray bone, which
On
is
the
very
DEXA scans.
fragile.
Yes.
And if it breaks, it doesn't break like a regular bone. It shatters like old crystal. So it never heals right again. So she was told to go on the bisphosphonates or the Fosamax.
Yep.
And
That was one of the first.
that was the first. And so what did I said, wait a minute, give me 6 months because that's what we had at that time. Now, give me 3 months, but we'll get to that. Give me 6 months. And so we started working with her. Working with her because where do you begin? Digestion. Many women or many people in their 60s, their hydrochloric acid has reduced. They can absorb, break down to absorption proteins. So we began with digestion. We looked at her hormones. We looked at her supplements. I actually lowered her calcium. At that time, her doctor went crazy. She was on, I think, 1,400 or 1,600 milligrams of calcium.
Oh
I
my
brought her
goodness.
down to 800, and her doctor was very upset. And I brought her magnesium up. So I balanced the calcium and the magnesium. And then I worked with her hormones. At that time, there was a new revelation that DHEA worked very well to support the bone, and I balanced her hormone with progesterone, with estrogen, and by the end of the year, are you sitting?
Yes.
We had a 9% increase in her bone density.
Yep.
She was my most dramatic case. I could generally depend on 2 and 3%, or if things weren't working right, or someone, what would happen is there would be a block in the breakdown, and that was before we knew what we know now. Now the information, excuse me, is so dramatic, and our understanding is so much deeper that we really could say that osteoporosis has a potential of being something of the past. It's really exciting.
Yeah, you can reverse it. And then maybe you won't get cavities. So so I just
That's a
wonder
possibility.
what the tendency there is. I'm looking forward to making some changes in my mouth so I don't have to have my mouth ripped up. Anytime you have to have dental procedures, it's risky business for a whole host of things. So this bone density, we used to see changes in bone density, not as dramatic as your patient, but just
Well,
adding
that was the
progesterone.
max.
Yeah,
What?
you
Yeah.
you did the max, but just with progesterone. Dr. Jerry Lynn Pryor, a researcher from British Columbia, and here's probably another thing people don't generally realize. You can be a young girl and already develop osteoporosis. So her cohort of patients were young athletes, and when you train hard, you compete, you just blow through your hormones like progesterone and estrogens. If you test for them, they're extremely low, and you can
And,
already
and you
test
surge
and
up your
find,
cortisol.
right, and cortisol is going to suck the living daylights out of your bones. So she she found that this was a serious problem in your younger decades, in your 20s, 30s. This is when you should be very actively building up bone because later on you don't restore it as quickly. We know that, but it's probably as a side effect of not really paying attention to the optimum nutrition and replenishment for osteoporosis.
Well, we didn't really know to the degree that we know now. We also now understand that SSRI, how many people are on antidepressants? Well, we'll just take an antidepressant.
Oh, tons.
Tons. And I didn't look up that number. But what's happening with antidepressants? It's blocking bone bone regeneration. It's blocking the ability of the osteoclast, which is the bone tearing down or cleansing part molecule in the bone, and it blocks the osteoblast, which is the bone building. So what they're finding is that of those people who have been on SSRIs for many years, they're finding a 61% increase in that population in osteoporosis. Here you go, and you're depressed, you're feeling bad, you're given a pill, and now you have to make a choice between your mind and your attitude and your body, your bones, your skeletal structure. That's a big uh, that's a big problem.
So I just had a client not too long ago, and we had some serum tests, and they happened to measure parathyroid hormone. So that gland is located around your gland. And a couple things happened. One was that she was using an antidepressant drug, and I forget the name of it. And I looked at the side effect profile, and sure enough, raised parathyroid hormone. And the consequence of this is parathyroid hormone, when it's excessive, it pulls calcium right out of your bones and into your bloodstream. So if you're checking your calcium levels in your usual foundational workup for your labs, if you're starting to see a high calcium, you know something's going awry. And interesting enough, she stopped the drug immediately because it scared her. And then I don't usually recommend that. I'd really rather her taper and get off slowly. But she just did it, and she started some generous doses of progesterone and retested in 1 month, and everything was back to normal.
Oh, wow, that was a fast response. That's
Yeah.
wonderful.
But I'm glad you brought up this antidepressant connection, because we are using these drugs way too much, and in many cases, what we're chasing is a hormone issue, lots of hormone
Imbalance and
imbalances.
nutrient imbalance.
And the drugs like SSRIs are not the solution. You have to correct what your body actually uses in its physiology.
So let's talk about how estrogen influences the activity of bone building and bone destroying cells. Estrogen activates genes that increase bone building, osteoblast activity, and collagen production through insulin like growth factors. So it's working through IGF-1 or through growth hormone. It's working through the osteoblasts, and it's also suppressing bone destroying osteoclasts by
Yes.
decreasing the level of specific chemicals or proteins in the bone. So you have estrogen acting as an incredible bone balancer. You know, the injustice that was done to women after the women's initiative, when everybody, I think it was 2000 or 2001, which was it? 2000. Everybody was terrified. I did a talk right after that study came out, and it was packed. It was a full area, and women were crying. What am I going to do? I don't want cancer. and here I am, and blah, 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 and blah, 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 all this stuff. Women were crying, and what was happening is that their whole body was shifting. And some of these problems that were being created weren't necessary. They needed to get off the synthetic estrogen and
Yeah.
progesterone. They didn't
Yes.
need to get off hormones. They needed to get off the synthetics. And that's the part that, we never really addressed to the degree that it needs to be addressed, because then that would create culpability in the medical community, and nobody wants to carry the blame.
I want to tie that on to what happens to women after hysterectomy. And
Oh,
this is
yes.
also a majority of reasons for having a hysterectomy are tied closely into a lack of progesterone. So we do a hysterectomy and we take out the ovaries, and women are given estrogen to protect their bones. But now we're out of balance. They've been out of balance with estrogen
That's why
being
they became,
dominant. Yeah, that's why they had the surgery in the first place. So then we give them back estrogen. We forget all of the other hormones, like you mentioned. And now we have high estrogen. So that high estrogen, this is information I got from Dr. Ray Peat, that high estrogen increases prolactin. It's a pituitary hormone. And this can go up. Progesterone will bring it down if it's estrogen related and not a tumor. But when it's going up like that, you have to worry about, is there a tumor in your pituitary, that's not very comfortable either. And then high prolactin leads to high parathyroid hormone that I just mentioned. And then that high parathyroid hormone pulls calcium out of your bones and puts it in the bloodstream. So now we have a situation, your doctor's telling you, you're going to have to take this estrogen to protect your bones, but you're setting up that patient for osteoporosis through its effect on these other hormones. So it's really frightening to me, because this is like a hardcore protocol. Oh, if you had a hysterectomy, you don't need any more progesterone.
well, Carol and I talk regularly ad nauseum on hypothyroid, but many of us don't understand that it's considered a hidden risk factor for osteoporosis, that hypothyroid subclinical. So all the tests are pretty normal. The TSH is a little low, the T4 normal, the T3 normal, but TSH. But it can lead to symptoms that clinicians can overlook besides these milder symptoms. Research indicates it's associated with a 61% increase for hip fractures and a 98% increase for any type of fracture. So that has to be looked at. Your
Okay,
thyroid, you want your thyroid balance. Go on, Carol.
hold the boat. We also have in our medical system, we have a big warning not to use thyroid because it causes osteoporosis. So we see this,
Well,
and way back when, there was a drug, I remember it clearly, it was called Coloxin, and it was levothyroxine, and the dose was 4 milligrams. And if you have levothyroxine T4, normally the doses are now, they're like maybe a high of 200 micrograms, a whole 1,000% less. So we got this information, I believe, from using really excessive levothyroxine, which did have a negative effect on your bones.
exactly.
But on the switch side, you need that
Then we are afraid of it.
absolutely thyroid supplementation to help you remodel your bones constantly.
So everything, I think you might be hearing this. Everything is balance. It's all got to do with balance. It's not excess of one over everything else. It's not or suppression of something else over everything else. Prior to this, it was calcium, calcium, calcium. Then we realized that magnesium, we could build bone with just magnesium. But then something very, well, let me go to this first. Something came up that we really weren't paying attention to, and that's vitamin D. And vitamin D is essential, and and it allows the body to take up the minerals that the bones need. Okay, so you've got the calcium, the magnesium, the vitamin D. And we used that and we saw it assisted us when we were balancing hormones and giving that nutrient balance, it assisted us. And then we learned about something new. I'm giving it sequentially.
Okay.
And we started talking about vitamin K. And years ago, Sherry Lieberman and I started talking about vitamin K at 40 milligram, not 40 micrograms, 40 milligrams
Yeah, both
was
supplements
changing.
are in the micrograms now.
Y'all, yeah, they're hard to find, but we can tell you where to get them. And what happens, it was turning around osteoporosis in Japan. And studies were showing it. Now, there are a multitude of studies with thousands of people showing reversal of osteoporosis with 45 milligrams of vitamin K. Not K1,
K2.
it can be K2 because K2 converts to K4. K4 is really what you're looking at, and all the studies have been done on K4 and K7, which is also another form of vitamin K. But once we put that together, we had hip fractures were reduced by 73%, and vertebral fractures, where the spine gets crushed and you have a fracture, were reduced by 60%. This is really dramatic changes.
Do you remember we had Kate Blue? She's a naturopath. She wrote a book, Could It Be K2? And we interviewed you. Do you
Beautiful.
remember that? It was a long time
Yes.
ago. I think we should open up the phone lines.
Oh, the
What do you
number to
think?
call, 212-209-2877. 212-209-2877. And when we started all of this, women were coming in with cavitations in their jaw because they would go to the dentist and get work that wouldn't heal
Yep.
because they were on the bisphosphonates. And then when that got understood, you would have to write in your intake form going into the dentist that you weren't on bisphosphonates. You had to be off of them for 2 or 3 months before they would treat you.
At
that-
least. You can't
least.
heal. If you have any bone pulling or you want to do an implant, that bone won't heal when you're pre-treated with these drugs. Another thing, it's not as popular as it once was, but the drug Coumadin, and it is a vitamin K antagonist. And if you are using Coumadin for blood thinning, for history of clots or surgeries or whatever, the side effect of using Coumadin, or warfarin is its generic name, is you just go ahead and develop osteoporosis because you don't have the vitamin K that you need. So I think it's a travesty. We really don't let people know the consequences of some of the things they choose to do. And part of it is there's so much information available, but if in
You
your
get
normal
overwhelmed.
interactions they're too short, too limited, and it's said with authority, you have to do this, 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 like choose to use bisphosphonates, you're told it's the only choice you have when you have many, many more choices.
The number
It's
to call is 212-209-2877. 212-209-2877. And the way we used to test people was with a DEXA scan. And blah, 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 a DEXA scan is an x-ray of the bone that looks at the structure of the bone to tell us whether our bones are strong. Well, 60% of people who get positive DEXA scans can end up and have been shown to end up with a fracture because it's not accurate. It's not accurate enough. And so now we have different ways of looking at the bone. DEXA is still part of the test, but we have different ways of looking at the bone. DEXA
let me
takes a
give you
picture.
yeah, let me give you just an example of how dangerous that could be. There's a book called The Osteoporosis Myth, and if I remember correctly, the author is Gail Sampson. So what happened to her is she had a very athletic young daughter, about 18 years old, and for some reason she got a DEXA scan, and she was way below their desired ranges. And it turns out, so they wanted this young girl, even before she got married and had children, they wanted her to take bisphosphonates because of her low bone density. Well, she had her son tested, very low bone density. She had herself tested, very low bone density. So it had no reality to a healthy bone. These were healthy people and their bones were flexible, but they did not show up well on a DEXA scan. And so you have to consider, I don't know if they still do it, but the levels that they came out with, they chose a young woman, a young woman's level, Caucasian, and depending on your race, you could have different bone densities, and it was not generally accounted for. So like, for example, Asians have much lower bone density. So if you're Asian and took a DEXA scan, you're already going to be told that you have osteopenia or osteoporosis because the standardization isn't there.
I think that now, at this point, the T-score is measured. T-score is the score you get that's equivalent to a 20-year-old, but it's measured by age and race. And the Z-score is equivalent to your age. So if you're 60, there's a T-score and a Z-score, and the Z-score is based on your age and your race. So that part is a little bit different. But that's a static picture. It doesn't tell you what's going on in your body. It doesn't tell you what has been going on. It's a static picture. But we now have new tests that are pretty exciting. And that's one, it's a urine test called a C-terminal teleopeptide. And what is that? That's a test that measures a fragment of the collagen that's found only in the bone. So if it's high in your blood, your bone is being broken down faster than your body is building it up. So it's a predictive relationship. It doesn't say what is going on with, it says what is going on with your bone right now, but it's also predicting the fact that there will be more problems in the future. Or if you have a low DEXA scan and you do the C-terminal teleopeptide, it will show that your and it comes out low. It can show you that your bone is building, so you're on the right program. So before they used to give you a program and then check you in a year or a year and a half. Now you can be checked every 3 months to make sure you have the program that's working for you and for your body. It's a pretty exciting time right now in this in this in this disease prognosis and paradigm. The paradigm has totally shifted, and the prognosis. I remember Alan Gaby wrote the first book I ever saw on osteoporosis, and he's a brilliant nutritionist, still writing to this day. And he said how to diagnose and reverse osteoporosis. And I thought to myself, I think he's exaggerating.
No, he
Oh
wasn't.
my goodness. What?
He wasn't.
He
There's
wasn't. He wasn't.
no,
The number to
he.
call is 212-209-2877. Give us a call, or you can type in a question on YouTube and we'll be glad to answer it. Okay? Go on,
So,
Carol. I didn't mean to interrupt you.
so he was just great because he identified nutrients that your bones needed and diet and
And that we were
lifestyle
low on.
that you should be addressing, plus all the hormones involved, like progesterone and DHEA and testosterone. So it's a combination support thing. And they even went so far, he partnered with Dr. Jonathan Wright, and they created a supplement. This was long ago. I forget how
Guess
long
what?
ago the book was. The supplement's still going.
25 years. It's still fabulous. It's got the whole, they had an understanding 25 years ago that this was a nutrient balance that women need, and many of the things that are were deficient in. But they were also the first, he was the first people to say, you're taking too much calcium. They made their formulas with 800 milligrams of calcium and 600 or 400 milligrams of magnesium. Now I would go 8 and 8, or I'd even go lower in calcium and higher in magnesium. It's a different understanding, but unbelievable the foresight that they had, the understanding of nutrition that they had 25 years ago. I started going to
Better than
classes
now.
with him in the 1990s. Oh, yes.
Yeah.
Yes.
About that time, I went to a lecture, and I do not recall the name of the lecturer, but he was presenting to about 200 people. There was a good big crowd. And this man said, and this is when we were doing 1-to-1 calcium magnesium or 2-to-1 calcium magnesium. He said, I beg to differ. You need 4 times the magnesium to calcium. And Corinne, I kid you not, the whole room went,
I know. Well, now you know how I felt talking about 40 milligrams of vitamin K at that time.
There was another thing that happened, and this particular lady sort of haunts me. She's very petite. She was an older lady, identified she had osteoporosis, and in those days, prior to bisphosphonates, we gave her fluoride
Oh,
with the understanding that fluoride is substituting for calcium in the bones, and your bones would be higher. So you're going to get a good DEXA
denser.
scan. Yeah, you're going to get a DEXA scan reading. You're not going to get healthy bone. And all this fluoride, like sometimes you see fluorosis, back to dentistry, you see these opaque white patches on teeth. This is where fluoride has integrated into the tooth structure, making it harder. And it's considered not that attractive cosmetically, but there really isn't much you can do about it.
Once it's there.
Yeah, it's really, really a pity. And then she was put on the first bisphosphonate, which I think was Didronel was the name. And I'm thinking, with my mind's eye, we never did her very much good at all. In fact, we probably caused her a lot of harm. It really does disturb me even to this day.
Well, guess what? We're learning. We're learning and learning and learning. And our relationship to learning is with an insight into the cause and how to create this in a way that builds the patient, strengthens the patient. I had a young woman who came into me very slim, very slight, and she had bones that they said if you sneeze, you're going to have fractures. So we do understand that under 115 pounds, there's a possibility, a higher incidence of osteoporosis. You need that weight. You need the gravity and resistance. So but I didn't want her too active. So we got on a program that was very good, high progesterone, very good nutrients. Her looked at her foods. She was Italian. And I also got her a vest, which I put very low weights in that I had her wear all the time. A weighted vest. And now she was losing bone. They were watching it. And what happened was that she really didn't gain bone. But that was 25 years ago, and she was supposed to be having fractures all the way through. And there has not been one fracture. She's very physically active, and she's doing very well. But there has been very slight bone regrowth. Come to find out, she had she was having reactions to wheat. And so
Yeah.
when we reduced that, she had
Made a big
things
difference.
started balancing out better. But we do have someone on the line. So hi, you're live. Your name, please. Hello.
Hello,
Hello.
Hi, your name, please.
James.
Hi,
Hi,
James.
James.
How are you?
Hey, how you doing?
Terrific. How can we help you?
Well, I had a couple of things. Would you consider putting on your website's a recommended book list?
Oh,
We have
I have
some.
on my website. I do have a number of books. I've done book reviews, so they are my recommendations.
I have
I
some
mean,
also.
like to do it on a regular basis. When you come across one.
Yeah.
Okay?
We do. Actually, we do.
It would be on our
Uh
websites.
huh.
The other thing, have you? I read a book years ago about by Dr. Google. Have you ever heard of protein-induced hypercalciuria?
Ah, no.
What do you
Like
think?
how athletes, like people who work out in the
They
gym
get
and
a
want to, they get,
protein poisoning from excessive proteins?
It's
Well,
probably because you need calcium to balance the acidic nature of high protein.
yeah, basically what he was saying is that that osteoporosis is not a disease of calcium deficiency; it's a disease of calcium loss, and that the high sulfur-containing amino acids that people get in their diet, too much of it, will chelate the calcium out of the body. And he gave some examples. He said, like the Bantu in Africa, they got about 400 milligrams of calcium per day, and they had virtually no osteoporosis. But their genetic relatives here in the United States, who had the sad American diet, had a very high amount of osteoporosis. And he said the Inuit in Alaska, who got about 2,000 milligrams of calcium per day, but had very high protein in their diets from fish and whale and stuff like that, had the highest incidence of osteoporosis in the world. And also, he was saying that caffeine and also phosphorus found in a lot of fizz drinks that would also chelate calcium out of the bones. And then consequent to that, people would get calcium kidney stones and uric acid kidney stones. And so some of the things he said about very low protein I didn't agree with, but
Yeah, no,
what he said about osteoporosis was very interesting.
well, yes, and we know that as people age, their hydrochloric acid goes down, so they're not digesting. And we also know that they need their proteins to reproduce their cells. That regeneration is protein based with minerals and B vitamins. And if you're not getting enough protein, and I'm not saying high amounts, but you need a degree of protein and you need to be aware of that to be able to maintain your bone, to build muscle, to build collagen. You know, when you see a woman who has very, very wrinkly skin, those fine, dry wrinkles, when you look at her, she's got weak bones. And that's very, very common. And the reason being is because collagen affects the skin and reduces the pores on the skin and strengthens the skin tensor strength, the elasticity of the skin. But it also is the base of bones. So you can literally, there are certain tricks that you could do. There's another one where you stand with your back against the wall, and if your head can't touch the wall, you're in the middle of bone loss because your head should be able to touch the wall. And so that is another one of the symptoms of bone loss. So it's a multiple.
Quality of hair and nails too. If
Exactly.
you're not growing nails well, not growing hair well, that also indicates you're going to have trouble with remodeling your
Well, that could be
bones.
thyroid as well.
Yeah. Yep.
Talking about, you mentioned thyroid before.
And
Uh,
we have two other callers in so much time. So can you save that for another time?
oh, okay.
Okay, thank you, James.
Thank you,
Hi,
James.
you're live. Your name, please.
Rashad.
Hi, Lashad. How can we help you?
Yes, listen to the program. Wanted to ask a question. Do you ever hear of this book called The Calcium Lie by Dr. Robert Thompson,
Yes.
Kathleen Barnes?
Yes.
What's your take on that?
I think it also involves.
Is he the doctor from Alaska?
Yeah.
The
That's
yeah,
him.
we had him on the show about 15, 17 years ago.
Oh, wow.
Go on. Yeah,
So-
a long time ago when he first wrote that book.
Oh, okay.
Go on.
And there's the tendency was to calcium and calcium only, and we know now, like I mentioned before, magnesium might be even more important. So if you're lacking that, it's a big problem if you load up on calcium. Also, if you don't have vitamin K along with it, that calcium's not going to go into your bones. And
No,
so you're going to have calcium deposits in other tissues,
in your
which is a problem.
joints,
Yeah, yeah.
in your arteries. So you really want to direct it, and you want to direct it with MK4, MK2, or MK7, which is very important to help you clear out your arteries and direct the calcium to areas in your body that benefit your bones, your arteries, and vitamin K is like a little bit of a miracle nutrient. What do you think, Carol?
Yeah. Also, I did hear a lecture. It's very similar to coenzyme Q10, and you could use either.
And it's
And
much cheaper.
yeah, and sure enough, I looked it up. Wikipedia is good for structures. If you're looking for a structure of something, they do have those. And so I looked it up. Sure enough, very similar in structure.
So
Nothing.
thank you for your call.
Yeah.
Oh,
Okay,
I'm
we got just a few minutes. We got one more caller.
Hi, you're live. Your name, please.
Hi, my name is Noel. Can you hear me?
Yes, perfectly.
Thank you.
Yes. You were the people who told me about magnesium L-threonate. Earlier, you were talking about calcium to magnesium. Do you recommend the glycinate or the L-threonate?
The L-threonate is the only magnesium that does cross the blood-brain barrier, and it sits at the GABA receptor, so it's really good for calming. Glycinate also has some calming features, which can be very, very good, and it helps you with the integrity of your gut too. So it's a very popular one. So there's a little bit different aspects of each kind of magnesium you can use. Generally,
And
I say you can mix and match, and I like to see 1,000 milligrams of elemental magnesium every day.
Okay,
and
and you also turned me on to that book about magnesium. I don't have it in front of me.
oh, the
Yeah,
uh-huh.
the very last question, because I know we're coming up to the end of the show. I
Yeah,
see
we are.
an NAD with NR and MHN. Is there anything else that I could take to make that more absorbable, like a fat or something like that? That's my final question.
So
Is the
so you said
magnesium more absorbable?
no.
No,
He
no,
said
the NAD. I saw
NAD
here.
Oh,
for
The
NAD.
making
NAD with
NAD.
NR and MHN. Is there anything I can take, like a fat or strawberries or something, to help it be more
In
absorbable?
Yeah, in general, have food with it because your body's digestive system is revved up to absorb more.
Okay,
And then I was seeing on a podcast, but I know some companies sell it, just NMN powder, and people are just taking scoops of it and holding it in their mouth.
okay. All right, and that's
Okay.
something to absorb?
Okay,
Thank you.
thank you.
Thank you so much. And call back next week. We'd love to talk with you. Carol, so
Yeah,
that was a show.
no
Now,
kidding.
every time we do a show, I learn.
Oh, me too. Me
It's
too.
wonderful. Carol, what's your website? And
My website is the Wellness by Design Project, and I also have a YouTube site with the same name. Corinne and I have a Facebook page, Take Charge of Your Health with Corinne and Carol. Also on Facebook, we have a group, Progesterone for Men. And Corinne?
and we have a YouTube. We have a YouTube, Take Charge of Your Health Radio. So this, you can go to YouTube and get a copy of this show. It'll be up shortly. And I'm Corinne Health. If you go to my website or to Carol's website, plan to spend time. We have amazing articles, and we have lots of information. So, Corinne Health, and I have a Facebook page also, Corinne Furnari, PACCN, and give us a shout out. You can DM us and we'll respond. We keep an eye on our pages. So thank you for sharing this time with us. I really appreciate it. Thank you, Carol. Every time
Thank
we're
you.
together, I learn and I
And
enjoy.
yes, and thank you to our callers and the rest of our audience. Thanks for tuning in. And we'll be back next week.
Bye bye.